2019, I got the opportunity to spend 6 months with the United Nations University International Institute for Global Health, which is based in Malaysia. UNU-IIGH is the global health think tank for the UN, and there had been a recently signed memorandum of understanding between WHO and UNU-IIGH. So within this agreement, there was an interest to explore an area of mutual interest, which it was community engagement and the human dimensions of health systems. The agreement also covered staff exchanges, and so I was very lucky to be the first one to move from WHO to UNU-IIGH. It was a great opportunity to take stock of the technical work that we've been doing within the department. It was really important to spend time with researchers and get to know and understand their world. I had hoped to come back to WHO more energized, intellectually enriched from that experience. The focus on community engagement and the human dimensions of health systems is really important. In 2003, Lucy Gilson wrote that health systems are inherently relational, and a lot of the challenges are challenges around people and relationships. 2 decades later, 3 global reports came out in 2018, 2019, talking about high quality health systems. And yet, in each of those reports, the human dimensions of health systems, or the human aspects of what contributes to poor quality of care, and also what could support improving quality of care in health systems, was not substantively addressed. At the same time, WHO member states have committed to integrated, people-centred health services. So integration and people-centredness are 2 concepts that keep coming up. And so if we are to address integration, we have to address social integration and how it supports better health programming or better service experience, or how it contributes to health outcomes. But inevitably, different people have to come and try and understand each other's perspectives and viewpoints and come to a common understanding and a common goal that they all have to work towards.
Ubuntu, in very broad terms, is an ethic of interdependence. It's an ethic that recognizes that everything that I do has an effect on you and your well-being, and everything that you do has an effect on me and my well-being. That we, although we are different people, we are essentially interconnected.
The community engagement literature is missing an understanding of what's happening inside people and what's happening between people as they engage and interact with each other. Often the focus has been on the conditions under which that engagement takes place. Is there a committee? Is there a structure? Is there a mechanism for soliciting feedback? Are there ways of listening? And that still stays at a very superficial level. If we are truly to understand and leverage the power of human connectivity, then we have to go a little bit deeper and understand the mechanisms of our own social engagement systems.
Your mind is something more than just what happens in your brain, but actually is a process that is emerging from energy and information flow, yes, happening in your brain for sure, so we can study the science of the brain in your head. But a fully embodied experience is also what the mind is, besides just brain activity. Now, the mind, seen as an emergent property of energy flow, isn't limited by your skull or skin. And it's actually also arising in your relationships with others. Now, through a long line of scientific reasoning and empirical findings, what the field I work in, interpersonal neurobiology, says, and we combine all the fields of science into one framework, is that the basis of resilience, the basis of well-being, is a process called integration. And integration is where you differentiate things and then link them together. Now, when you integrate your own inner system, you get a feeling of well-being and thriving. You're flexible, adaptive. Coherent is the math term for resilient, energized, and stable. Now, when you bring that kind of integration into the relational aspect of your mind, the natural process that arises is actually being kind and compassionate.
Traditionally, the health sector has seen communities as being outside of health systems. Treating communities as separate doesn't really give us the opportunity to factor in the business of relationship building. So it's been important to look at that interface and explore that relational interface to better understand what exactly is going on and how can we address this issue of building trust and respect within the healthcare environment.
When most people think about communication, they have a tendency to think about the message or what we have to say. And certainly that's important, and nobody wants to take away from that. But when they focus on that, they miss perhaps the most important aspect of human communication, and that it's bioactive. Human communication literally plays a role in our biology and the biology of the people that we're talking to. Let me provide some examples. First, we know that the way we talk with each other literally creates and shapes brain structure, that your brain functions as we know it in part because of the communication environment that you live in and the conversations that you have. So, for example, we also know that it affects us at the epigenetic level, that it can make a difference in how your genes function and whether they turn on or off. And certainly we have more to explore with this, but the potential for us thinking about how we communicate and how that impacts our gene functioning is certainly a critical thing. We have found, for example, that in certain kinds of structured narrative therapy, where they were leading people who had PTSD through structured telling of their stories, that after 8 weeks of that type of communication, they actually had repair of damaged DNA. So the impact can be really great. We can go further, though, and look at some of the specific instances. So, for example, they find that cardiovascular disease is linked to our ability to express positive emotions with our face. So it's not simply feeling the emotion, but how we express the emotion, and that makes a difference. Those are trainable skills that can make a difference in our CVD profile. In other studies, they found that how well the physician creates an empathic connection with their patient can make a difference in how long the illness goes on for the patient. So they can actually shorten duration of illness by creating that kind of empathic connection. So certainly we know that the way we communicate is bioactive and that that's powerful. It's also important to appreciate that that's systemic within the body, but it's also systemic outside of the body and with other people. So it is appropriate to think of all disease as communicable at some level. Some are infectious, but others we can actually affect the prognosis or the etiology of that disease by the way that we communicate with each other. And that's what we mean by communication is bioactive. And it also is why we have to think about how we communicate at least as much as we think about what we communicate if we want to be more effective at what we do.
approaches that were suggested by Claudia was to bring together an internal group to unpack and discover what community was all about. And so over the period of time, we were able to bring, look at the literature, we were able to bring projects, we were able to bring in external speakers, we were able to see, understand how the community within IIGH functioned and what influenced and shaped those interactions, so that we could then use that as a lived experience model for understanding how we need to be approaching this whole area of community engagement.
So some of the sessions I prepared them with Asiya, and we had weekly meetings to decide what would be the topic of the session, what would be the format.
It's like a platform for the colleagues to interact with each other.
Togetherness and also reflection.
Knowledge sharing, and you're always taking away something. You learn something basically through each session.
Lunch meeting, even though I don't have lunch meeting.
Heart rate variability discussions, which I felt was really it was just really interesting, because I never really thought about it, and like the technique of breathing, and it affects your heart rate. It was things that I never really thought about, and then when we were doing that session, it all just suddenly made sense.
We had with Lavanya preparing for the Kigali presentation or meeting she was going to be on a panel on.
Everybody comes in different part of their days, having done different things, and so when we come in, we are like a scrambled piece of group. But after the meditation, it's like the anxiety or the distractions have melted away, and people are just around the circle as they are, and ready to receive, ready to give, not distracted. And I think that's the purest time where everybody can learn and exchange information.
I will say that the significant moment actually is the 5 minutes meditation moment.
Okay.
I think that one is very important, and to me, as well as like to free up our headspace and to put ourselves committed to this session. I think that's the start, the beginning of the community engagement. The meditation program is something very important to me.
Okay.
When we had an expert join in to talk to us about communication, sort of as a discipline, and sort of how things have been evolving in the thinking and paradigms in that discipline, and obviously how that relates to community engagement, I thought that was very eye-opening for me.
The seminar that you delivered, because I felt that was very informative and very inspiring, particularly the work that you presented on the community health workers and the Ebola response. And also the fact that that was one of the most attended seminars since I've been here at IIGH, and it brought together a room filled with civil society organizations, non-profits. So it's a really good networking opportunity to really see what's going on the ground.
Wouldn't be able to work and to connect with the team in a way that I do now without these sessions that we had together. And as the Friday afternoons were the only time that all the team came together and reflect together, and being open with each other without any kind of resistances, feeling that we are in a safe place and we can talk to each other about our experiences as a team, about the work, about the struggles that we are having. For example, if you have conferences, what will be the best way to approach the audience?
Being more self-reflective before I start a task, or when I get assigned a task, to understand firstly my own preconceived notions towards that particular project, and then to take a step back and understand how to actually approach this objectively.
Since being part of the community engagement group, I've incorporated meditation into my daily routine because I can see the difference that happens just by sitting in a 5 minutes session of meditation here. So I start my day and end my day with meditation. So I start with reflection and end with reflection. It makes me a better person when I come to work in a way that I am settled. When I come to work, I'm clear, my mind is clear, and I am more productive in a way.
I feel more comfortable when I start conversation with especially with someone who are in this community engaged group. For example, Claudia, like I don't have any work. I didn't have chance to work with her, but I feel very comfortable to talk to her. Yes, of course I do. And I think it's especially good for institutions like IIGH because turnover rate of IIGH is quite high. And if you have community engaged group going on, then someone who just landed in this institute would feel very, like, I think they can easily settle in.
Okay. Yes, I think it's a really important space for colleagues to come together.
Yes, I would like the community engagement group to continue. And it seems to be tailored a bit out of the usual typical research academic sort of style. It brings people together and people actually talk to one another. So that's one thing that I really appreciate from the community engagement sessions. And it also gives me an opportunity to understand the other work that the researchers do that sometimes might not get translated to the program staff. So I thought that was quite a good time as well.
Capital YES.
So what are my takeaways from this whole experience? I think the first one is a commitment to the science, to developing the science and practice of community engagement. There's an incredible amount of knowledge that lies in different disciplines and in different sectors, and we need to pull that together into a robust theory that situates community engagement within the context of human engagement and human development. We have to fundamentally shift from looking at part of a person to looking at a whole person, that an individual is not just the disease that they have, but they are a human being. They have mind, body, spirit, that they live with in a certain context, that there's more to a person than the disease that they're presenting with. And I think community engagement can help us in pursuing or bringing or shifting us away from a disease focus to a whole person focus. And I think we can draw upon the brain science, on relational science, on communication science. Somehow it's at the interface between these three sciences that can really help us understand what do we need to know about how engagement occurs and how engagement works within people and between people. A community engagement theory has to be aligned with human health and well-being and development, and we should move away from seeing community engagement as purely a mechanism for getting things done. Yes, it's important, and we do need to reach communities with uptake of health interventions, but there's a lot more that we can do to support the health and well-being of people beyond a mechanistic approach. we also have to factor in the evidence of lived experience and social interaction. And this will require different methodologies, it will require different ways of measuring, it will require us to move away from linear cause and effect approaches to complexity-based approaches. And human beings are complex. The world that we live in complex. So why should we imagine that community engagement is going to be done in a linear way, or that it's going to be easy to be able to measure the impact that it has? And this is something that we need to embrace, complexity for community engagement, if we are to support how it further evolves and its contribution to global public health.